Today we'll be talking about another important organism, Hemophilus. General consideration, it's a pleomorphic gram-negative bacilli. It requires special growth factors present in blood, factor 10 and factor 5. It is oxidase positive and it is capsulated. The various species in the family include Hemophilus influenzae, Hemophilus ducreyi, Hemophilus aegypticus, Hemolyticus, Parahemolyticus and Parainfluenzae. Growth requirements. Factor 10 is hemin or other porphyrins required for the synthesis of enzymes such as cytochrome, catalase and peroxidase. Is involved in aerobic respiration of the bacteria. Factor 5, nicotinamide adenine dinucleotide, NAD, and it does not grow on ordinary media unless these two factors are present. Growth is scanty on blood agar. Only factor 10 is available in blood agar and factor 5 factor is present mainly inside the RBCs. Sheep blood contains NADase that destroys factor 5. Hence the growth on blood agar is very scanty. It grows well on chocolate agar where the RBCs have been broken down and factor 5 is available in abundance in the media. What is satellitism? When Staph aureus is streaked across a blood agar plate, you will see the growth of Hemophilus closest to the Staph aureus and it becomes smaller as you go further away from the area of Staph aureus. This picture depicts the same phenomenon of satellitism. In the central you can see the line of Staph aureus streaked across, while the horizontal lines are those of Hemophilus which have grown in large numbers closer to the Staph aureus and they become smaller as you go out to the periphery. What are the virulence factors? Capsular polysaccharide is the most important virulence factor for Hemophilus influenzae. It inhibits phagocytosis. It produces endotoxin, inflammatory response. It's got outer membrane proteins. IgA protease inactivates IgA, which is an immunoglobulin present on the mucosal surface. It's got pili and other adhesive proteins which help in colonization on epithelial surface. It affects the central nervous system where it is one of the most dangerous pathogens, causing pyogenic meningitis. It is seen in children less than 2 years. There is fever, neck rigidity, vomiting, headache and altered sensorium. It causes subdural effusion. It's a common complication following meningitis, seizures or hemiparesis. Mortality rate is high and neurological sequelae occur. Epiglottitis, one of the most life-threatening conditions that occur in children, is by Hemophilus influenzae. It affects older children 2 to 7 years old and rarely seen in adults. So if you see a child who is unable to breathe and is struggling to get air in, please open his mouth and look for the epiglottitis, and then immediate treatment with suitable antibiotics helps. Pneumonia in infants, similar to other bacterial pneumonia with more pleural involvement. Less common invasive conditions seen in children caused by Hemophilus influenzae are cellulitis of neck and head region, osteomyelitis, septic arthritis, pericarditis, orbital cellulitis, endophthalmitis, urinary tract infection, bacteremia without any identified focus. There is a certain entity known as non-typable H. influenzae. They cause contagious spread and usually affect adults. It causes childhood otitis media. It causes exacerbation of chronic obstructive pulmonary disease. Pneumonia in adults with underlying COPD or AIDS can cause puerperal sepsis and neonatal bacteremia. Causes sinusitis in adults and children. Invasive infections early. Now, lab diagnosis. Specimen collection and transport for CSF, blood, sputum, pus, aspirated from joint, middle ear or sinuses. These are the specimens that need to be collected. It's highly sensitive to low temperature. Specimens should never be refrigerated, especially cerebrospinal fluid. You keep it at room temperature. The moment you put it into the fridge, the organism dies. On gram stain, you will see pleomorphic, gram-negative coccobacilli. Both the diagrams show you clearly what the bacteria look like. The arrows are pointing towards the gram-negative coccobacilli. They have very well delineated capsule which can be seen as a Quelang reaction. When you put antibody to the capsule, they cause a swelling of the bacteria around and is very easily seen. Antigen detection, the type B capsular antigen in CSF, urine or other body fluids can be detected by latex agglutination test or direct immunofluorescent test. It's highly fastidious. I already mentioned you require factor X and V, enhanced by 5 to 10%. CO2 in blood agar you see with Staph aureus, you see Satellitism, which I showed you earlier also. In chocolate agar it grows well. Fildes and Levanthal's agar are other media, transport media, iridescent colonies. Hemophilus selective media contains bacitracin and sucrose. Culture spheres will show you pleomorphic gram-negative coccobacilli. They are catalase positive, oxidase positive. They reduce nitrates to nitrite, ferment glucose and xylose, but not sucrose, lactose and mannitol. This test for X and V requirement, Hemophilus, these factors are available in a disc form. If you put them on the media, you will see growth surrounding these two discs is very evident, and when only X and V disc, only H. ducreyi and A. Aprophilus. Growth surrounding V and XV disc only for H. parainfluenzae, parahemolyticus and A. Aprophilus. So this chart depicts the growth characteristic of various Hemophilus species. As you can see, the factor 10 and factor 5 are evident. In ducreyi you don't require factor 5. In others, influenza, Aegypticus, hemolyticus, you require them. This is the difference between type B strains and non-typable strain. Type B is the most dangerous variety of H. influenzae. It has got a capsule made up of polyribosyl ribotyl phosphate. Its manifestations are invasive meningitis, epiglottitis, pneumonia, bacteremia, endocarditis, affects children. It can spread by the blood, and there is a Hemophilus influenza type V vaccine available, which is now being given to a large number of children all over the world to prevent any central nervous system infection by this bacteria. Typing methods, biotyping, you can based on biochemical properties, indole, ornithine, decarboxylase and urease, and serotyping can be done by type-specific antisera. Invasive infections of Hemophilus influenza type B can be treated with cephalosporins, ceftriaxone and cefotaxime, doxycycline. Non-typable strains of H. influenza are often resistant to beta-lactams. Beta-lactamase production is seen in 20 to 35% of strains, and they express altered penicillin binding protein. Prophylaxis, Hemophilus influenza type B conjugate strain. It uses the PRP capsular antigen of Hemophilus influenzae. Capsular antigens are poorly immunogenic to children, hence they are conjugated with adjuvants like diphtheria or tetanus toxoid and Neisseria meningitidis, and then the capsular antigen becomes more strongly immunogenic. You can also reduce the rate of pharyngeal colonization with Hemophilus influenza type B. Schedule on a national immunization program nowadays. Hemophilus influenza type B vaccine is given in combination with DPT and hepatitis B at 6, 10 and 14 weeks of birth. Please remember the dates. This is the new schedule of immunization and is a frequently asked question in your MCQs. Root is intramuscular at the anterolateral side of mid-thigh. We now come to another Hemophilus, also known as Hemophilus ducreyi. It causes a completely different condition of a sexually transmitted disease, the chancroid or the soft chancre is a sexually transmitted infection, causes a painful genital ulceration that bleeds easily. Compared to syphilis, where there is no pain, this has got painful ulcer that bleeds. There is no inflammation of the surrounding skin. There are enlarged inguinal lymph nodes, also known as bubo. Common cause of genital ulcers in developing countries. Transmission is predominantly heterosexual. Male to female ratio is 3:1 to 25:1, and chancroid and HIV go hand in hand. Those with low immunity are likely to develop chancroid if they have picked up a sexually transmitted disease. Lab diagnosis: take out the exudate or swab from the edge of the ulcer and lymph node aspirate. Direct microscopy will show you pleomorphic gram-negative coccobacilli. They occur in groups or parallel chains. There's bipolar staining. It can look like a school of fish or railroad track appearance. It requires factor 10 Heman but not factor 5. Rabbit blood agar or chocolate agar enriched with isovitalex and made selective by adding vancomycin are important requirement for it to grow. Chorioallantoic membrane of the chick embryo is also a favorite site to grow for research purposes. Optimum conditions are 10% CO2, high humidity and incubation at 35 degrees for 2 to 8 days. Please remember, 35 degrees centigrade is the key for Hemophilus ducreyi. Biochemical is biochemically inert, gives no reaction with any of the sugars that we use. You can use a slide agglutination test for confirmation. You can do PCR, and treatment is with azithromycin, doxycycline. Alternate drugs are ceftriaxone, ciprofloxacin or erythromycin. Thank you.